Hey everyone, welcome back. Let's discuss some of the best natural treatment options for Candida. You might be surprised to hear that in some randomized control trials comparing herbs to drugs, in some cases, herbs have been shown to be twice as effective as drugs. We'll cover what herbal options you have for Candida, whether it be oral thrush, vaginal Candida, or gastrointestinal tract Candida. As you can imagine, there's a lot of overlap with herbs that will hit all three, but there are some nuanced differences in terms of what herb you may want to select depending on if it's mainly oral, vaginal, or gastrointestinal. And I'd like to lead with a quote from iLads. Evidence-based medicine is the integration of the best research evidence with clinical expertise and patient values. And this is what I think is sometimes underserved, wherein people are told about, well, you can use fluconazole, which by the way, we'll cover a study finding that garlic was as effective as fluconazole. Or maybe your conventional doctor wants to prescribe itraconazole, and a different herb was shown to be almost twice as effective as itraconazole. Now, it's not a contest in terms of herbs versus pharmaceuticals, but again, I do think in order for you to practice informed consent, you should be made aware of all your options. So let's do that today. Let's give you kind of the other side of the evidence regarding what natural and herbal treatments are available, effective, and studied for Candida. As just a little bit of context, Candida can present in a few different ways. Oral thrush, potentially bad breath, halitosis, maybe phlegm, vaginal Candida. Now, 75% of women will have at least one bout of vaginal Candida in their reproductive years. So one bout of vaginal Candida probably doesn't mean you have an issue per se, but if there's recurrence, then certainly this is something that we want to be resolving as best we can. And then gastrointestinally, more likely that Candida will manifest as diarrhea than constipation and also bloating. Given the impact the gut has on your body systemically, you may also see, and this has been published, an association to Candida overgrowth in the gastrointestinal tract and brain fog, depression, anxiety, or even chronic fatigue, as in chronic fatigue syndrome. Risk factors are antibiotic use, lots of stress, alcohol consumption, and a high sugar or high starch diet. The thing that I find really promising about herbal medicine, and this is quoting or borrowing from Bill Rawls, who probably took this from somebody else, we can essentially borrow the immune system of plants. Because, if you picture sort of a forest, some plants or even trees, you'll see mold or fungus growing on them. So one of the things that fungus is trying to do is to recycle plants back into the earth. So plants need to develop antifungal mechanisms or secrete antifungal, let's say, alkaloids to protect them. We can borrow those and use those to protect ourselves from and or clear Candida, Candida biofilm, and even these filaments called candidal hyphae. So starting with vaginal Candida, we have discussed on the show in the past this wonderful study, 2015 randomized control trial, that 1,500 milligrams per day, so a 500 milligram capsule taken 3 times per day, was as effective as fluconazole, the medication, for vaginal Candida. The good news does not stop there, however. Another compound known as horopito, or sold oftentimes under the brand name of Colorex, this is a herb native to New Zealand, has been studied in a couple clinical trials, one of which I find very exciting. 2011 randomized control trial. Half of the women were given itraconazole, the medication for the pharmaceutical, for 6 months, and then monitored for an additional 6 months. And the comparison group was given horopito for 6 months, and then also followed up for 6 months post-treatment. Look at this, the cure rate. Itraconazole, 34%. Not bad. Horopito, 66%, and this group had significantly fewer relapses than the itraconazole group at the end of the 12-month study. There are also other herbs that you can consider. Chamomile extract or sage have also been shown to be beneficial for vaginal Candida. The sage was used as a vaginal deposited tablet, and the chamomile was used as a cream. I also want to make sure to mention that probiotics are powerful antifungals. 2023 randomized control trial, probiotics were found to have similar efficacy, again, looking at the pharmaceutical fluconazole as the comparison when treating vaginal candida. And the good news with probiotics does not stop there. A group of researchers wanted to study the body of evidence more broadly, and they performed a meta-analysis summarizing results from 6 different randomized control trials. I'll just quote, "Probiotics showed a favorable effect in the treatment of vaginal candida." So for vaginal candida, you have some great options. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health, so it is quite deeply appreciated. Coming now to oral thrush. This is the white tongue, potentially bad breath. The strongest evidence, this is in vitro, so let me take a step back and clarify. There is more research on the pharmaceuticals. This is where I do feel the pharmaceuticals have an edge. So in this case, the best data we have is not the randomized control trials like we talked about before, but rather in vitro evidence showing that these oils, out of all the ones studied, or you could do a tincture, were found to be the most powerful antifungal. Garlic, cinnamon, and lemongrass. You can buy these as an oil or as a tincture. Simply put a few drops in water and then use 1 or 2 minutes sort of as a mouthwash rinse. And the way I'd recommend using this is swallowing the rinse afterwards, and then don't eat or drink anything for at least 15 to 30 minutes afterward to allow that to sort of sit in the mouth and have the antifungal effect. It wouldn't be a smart idea to do the mouthwash and then eat right afterwards because you're kind of going to wash it all out of the oral cavity. There are a few others that have also been shown to have antifungal activity, including clove, oregano, and neem. Once more, I want to echo the power of probiotics. In this case, a 2019 randomized control trial summarizing the results from 8 different studies. And they used either a Saccharomyces probiotic in some of the research or different blends of lactobacillus and bifidobacterium probiotics. And like we've discussed in the past, if you take an honest look at the research literature, you see that different clinical trials with different lactobacillus, different bifidobacterium are all having benefits for fungus. So I don't think a highly specific formula is needed to improve, in this case, oral candida. But quoting from this meta-analysis, we are confident in declaring that probiotics can have a beneficial effect on reducing oral candida counts. So I would suggest to pair whatever herbal intervention along with probiotics. Then coming to what I consider perhaps the most important location to treat fungus would be your gut. This is theoretical, but I think it makes sense. And sort of the naturopathic philosophy on this is fungal overgrowths start from the gut and then work their way outward. That might not be always true and the case, but I think it's probably generally true. I also wanted to share this study from gastroenterologist Satish Rao, who's been on the podcast in the past, looking at people with unexplained gastrointestinal symptoms. Remember earlier I discussed bloating, loose bowels as some of the most common presentation. He found that in these people with symptoms that didn't have a known cause, 21% had small intestinal fungal overgrowth. Sadly, this is an area where we don't have comparative randomized control trials. We have in vitro studies telling us about if these compounds have antifungal activity. However, coming back to my opening quote from iLads, evidence-based medicine is a combination of the best evidence with clinical experience and patient preference. There is a lot of clinical data showing that people can, let's say, clear a stool test or a breath test when using various herbals like oregano and garlic. In fact, these are the 2 that I think are probably the most powerful and the best to consider utilizing if you have or suspect you have gastrointestinal candida. Oregano can be used at a dose of anywhere between 200 and 600 milligrams per day. Most oregano capsules are about 50 milligrams per capsule. And garlic can be used at 1,500 milligrams per day, given that study that we discussed earlier. And I think you can probably go higher with that dose, maybe as high as 4,500 milligrams per day. These are all things you want to check with your healthcare provider. But nevertheless, for gastrointestinal candida, at least to start, we're thinking oregano, garlic, And again, I would pair this with a probiotic, given the fact that we know that probiotics can, amongst other things, inhibit Candida biofilms. I'd also like to cover a phase 2, if you will, or a second level, stronger protocol for gastrointestinal Candida. And this is where I think there's merit for a formula that combines multiple different herbals together. Now, we've used, and we're in the process of publishing a paper that found that the Biotic Clear 2B blend, amongst others, was found to lead to about a 40% resolution rate of SIBO, that's small intestinal bacterial overgrowth, not SIFO, fungal overgrowth. But again, we do know that these compounds exert antifungal activity. So this formula includes caprylic acid, black walnut, oregano, and podiarco. There are other antifungals that have been shown to have, at least in vitro, herbals that have been shown to have in vitro antifungal activity. These include artemisinin, cinnamon, grapefruit, neem, berberine, tea tree oil, MCT, and lactoferrin. And I wanted to share with you this data table that we've been constructing for a while. What you're looking at here is a number of different natural agents: alicillin, artemisinin, banderol, cat's claw, cinnamon, clove. And what we're doing, given that we work with people who either we know have or we suspect have more than one organism at play. There might be Candida, but there might also be Babesia or Bartonella or another bacterial infection present. We're trying to better understand how do we personalize these recommendations based upon the person. So we're creating this data table that takes an agent and gives us what does it hit? Will it hit Borrelia, Bartonella, Babesia, and Candida? And the good news is there's a few compounds that hit mostly all or all of these. Artemisia, or wormwood, will hit fungus, and even going, and pardon me for being nerdy here, but even going a step further, Artemisia will hit both anti-Candida and it will fight the hyphae, or these anchoring filaments that when Candida goes chronic, it produces, which can make it harder to treat. While also Artemisia will hit Babesia and Borrelia. And then look at this. Cinnamon oil. It's anti-candidal, it's anti-candidal biofilm, it's anti-candidal hyphae, and we also have evidence in humans. Simultaneously, cinnamon, and this could be oil or it could be a tincture-based extract, which are usually alcohol-based, will be active against Babesia, Bartonella, and Borrelia, as will clove, and we'll also get some good coverage with grapefruit seed extract. All this just to impress upon you the amazing aspect that many herbal medicines have in that they will simultaneously hit multiple organisms at the same time. This also does hint at something else I feel important for you as a healthcare consumer to be thinking about, which is Candida can produce a die-off reaction when you treat it. So you may notice some joint pain, some brain fog, some fatigue that lasts a few days. However, some of these other organisms that something like cinnamon oil will also hit, Borrelia, Bartonella, and Babesia, they may produce a die-off after 1, 2, 3, or even 4 weeks into treatment. And a huge thank you to Tanya Dempsey and Joseph Burrascano for making me and us aware of the fact that die-off isn't always something that occurs the first, second, or third day in. Now, let me take a step back and just explain with die-off. This comes predominantly from Jerish Herxheimer, who was a researcher studying syphilis, and he noticed that when treating syphilis, there was a die-off that started the day of treatment and lasted usually 1 to 2 days. And so what's happened, I think, in the field is that sometimes people are assuming that this is what all die-off looks like. In fact, up until just recently, that was sort of my assumption. And as I've been doing more research and training into some of these other bacterial infections, I am realizing, and a huge thanks to the field, and especially from what clinicians are reporting, that you may not see die-off occurring until well into treatment. And this is really important to know because knowing this can help you set the expectation correctly and not stop treatment thinking that maybe you're having a flare. Now, why is this? Why is it that Some of these organisms, at least purportedly from clinicians who are working with patients and monitoring them and trying to better understand what the response curve looks like, is likely because these organisms can form biofilms. And biofilms essentially may break open 1, 2, 3, or 4 weeks into treatment. And when this happens, you can have an exacerbation of symptoms. And then the other thing that may happen is, depending on the life cycle of these bacteria, you may see a flaring when you get through to the next life cycle. Like with Borrelia, it tends to be a month growth cycle, and therefore you may not see, at least per Burrascano, a die-off until 1 month into treatment. So without going too far afield, I do feel this is important for you to be aware of, because it can be dissettling when you're doing something to improve your health and all of a sudden you feel like you backslide. And knowing how to interpret this is really important. And this is probably an area where you want to pull into your sphere a healthcare provider who can advise you on, well, I was feeling good up until 3 weeks in, and now all my symptoms came roaring back. Does that mean I should stop? And ironically, maybe the most key principle here is, and again, you want to always check this with your healthcare provider because I won't know the nuances of your situation, but a delayed exacerbation of symptoms may not mean you should stop. It may be a good sign that you should keep going. So leaving the Herxheimer's and the die-off aside, let's come back to what else we can use to improve Candida. Because Candida can form biofilms, enzymes or anti-biofilm agents are sometimes recommended. I wouldn't say these are needed for most cases, but if your case is chronic and it's somewhat resistant to treatment, then integration of some form of enzyme that breaks down biofilms is probably a good idea. Now, I'll share with you here the formula that we used in a study, again in SIBO, where we treated half of the individuals with herbal antimicrobials, and then the other half with those antimicrobials plus anti-biofilm agents. Now, we were actually not able to demonstrate much in the way of additional benefit when treating SIBO along with anti-biofilm agents. However, the more I'm learning about SIBO versus Candida versus some of these other non-SIBO bacteria, I'm starting to think that SIBO is not a major biofilm former. It does form biofilms, but my suspicion, just my opinion here, is that SIBO is minimal in terms of how much biofilm it forms, but Candida and especially Bartonella are much more robust in terms of their biofilm production. Now, biofilms are made predominantly of proteins and polysaccharides in this form of a matrix, like a film, really biofilm. So this is why in formulas you'll see things like enzymes that are specific to proteins and to polysaccharides. This is where you'll see cellulase, hemicellulase, lysozymes, serrapeptidase, amongst a few others. But these are all used collectively to break down the biofilms. This is also an area where we don't really have good scientific research. There was one study from a number of years ago looking at the stomach bacteria Helicobacter pylori or H. pylori, and they did find that when using N-acetylcysteine, there was a remarkable improvement in the effect of antibiotic therapy, but there hasn't really been a lot published showing in a randomized control trial setup that biofilms treatment, is effective. Our study certainly did not find anything super cathartic regarding SIBO, but I've seen enough wherein for some people, when you start them on an anti-biofilm agent, they actually have a die-off for a few days. So again, there's more here to learn. This is mainly taking from clinical anecdote, but nevertheless, I don't think we should just dismiss that, because in these more chronic cases, we want to dig a little deeper in terms of what can be done to help the individual. And there's really little to no downside for the most part with these enzymes. In fact, some of these enzymes actually notably help improve circulation. So there's some benefit associated with these. Just one or two snippets I wanted to add here about MCT oil. You can use it, it is antifungal, but the one challenge is you can only push the dose so high before people will experience diarrhea. So this is something I like as an add to a shake or to coffee perhaps. But is it a clinical mainstay of strong antifungal treatment? I don't think so, again, just because diarrhea is waiting around the corner for many people. Additionally, there are other agents you can use. This is not an exhaustive list, but one that I think is worth mentioning is lactoferrin, which is a glycoprotein found in colostrum with anti-candida properties. Also interesting, and also something we're experimenting with at the clinic, just not sure at this time if it would supplant some of these other herbals that are quite potent. I do want to just issue one reminder here of a study that we discussed on the podcast in the past that combined a Candida diet along with nystatin. And the clearance rate of Candida with nystatin alone was about 42%. When they combined that with a Candida diet, it went up to 85%. So a Candida diet, I think, is very important to synergize with whatever else you're doing, namely probiotics and some other form of herbal antimicrobial. The one caveat is that not all Candida diets need to be low carb. And why this matters is some people don't do well low carb. They don't sleep well. They get brain fog. Women may lose their cycles if they're too low carb for too long. So this is why I'm happy with the Candida diet that we put together. It's careful to give you the carbohydrate restrictions without just going too far to a low carb or a keto diet, which either one of those would work for Candida, but it will underserve the population of people who can't do them. And so the best treatment is the one that someone can be compliant with. So we want to keep that in mind. Okay, so then in recap, the foundation is a diet, probiotics, and lifestyle. Remember with lifestyle that many of these treatments will dampen the activity, the growth, the biofilm, the hyphae of the organism. But your immune system has to finish the job. And so if you're not sleeping, if you're not exercising, if you're drinking too much, if your diet is poor, all of these things will negate the ability of your immune system to really finish off the job of getting back to eubiosis or to balance. And then for vaginal, garlic, and horopito or colorex, orally, there's a few essential oils we discussed. And then for gastrointestinal, oregano, garlic, enzymes, probiotics are all viable. So there are a lot of options, and herbal medicines, as we've outlined, can be quite powerful. One other thought to leave you with is how to know if you're on the right track. If you're on the right track, there should be gradual and progressive improvement over time. Sure, there may be some ups and downs, but if you're a few months in and you're still trying to explain away why you're not getting better, oh, well, it must have been because I traveled, or it must have been because this one night I had off-plan food, I would consider that more likely an indication that you're not on the right track, you're not treating the right thing. If you do feel like you're not on the right track, reach out to us at the clinic. We're always happy to help, or any other qualified healthcare provider who you think can help guide you through this process. It's really important. You don't want to flounder too long. If it is the right treatment approach, again, there might be some ups and downs. There might be some die-off like we talked about, but generally speaking, month over month, you should be getting better. And if you find that you're still 2, 3 plus months into treatment and you're really sensitive, you're having reactions, you're having setbacks, then it might mean that Candida isn't the only thing present. And this, again, is where a healthcare provider can give you a fresh set of eyes to look over everything and try to figure out, firstly, if Candida is the issue. And then secondly, whether it is or is not, is there something else at play that's not being addressed? Okay, well, I hope this helps give you an appreciation, again, for how powerful herbal medicines are, and that you'll comment and let me know either how it goes or what you think. All right, until next time.